Hi everyone, my topic is renal biopsy function. So renal biopsy is basically they remove a small part of your tissue from the kidney and they test it, okay, for further any problems. So there are two kidneys, right? So usually which one they prefer is the left one. Why? Because all the major veins won't get affected that side. Alright, so that's why they preferably use the left side kidney. Now how this biopsy is done is like in the lower pole of your kidney. That means for normal patients, they will make them sleep backside and they will do the biopsy from here. For those who are obese, okay, only for them, they will be in a SALP position, that is a supine anterolateral position. That means this side, okay, the rest ones will be down. Now there are two types of biopsies that is done. One is precutaneous. In that comes the two types, that is precutaneous means basically it's done over, that means no cutting and all, directly. So you guys have heard about FNA, right? FNA is fine needle aspiration. Okay, so it's like a needle, a thick needle, they directly puncture it and pull it out, so small tissue comes along. In the other one is a needle core biopsy. In that you guys might have seen this particular kind of needle, like it will be like this. In this kind, it's like a round. They put it inside and then they will, once they pull it out, it will make a click sound and it will take out a big part of the tissue. Okay, so both of them are done above and they do not have any specific kind of after effect other than slight chances of having any kind of infections because they are needles, right? So this is done under ultrasound. Okay, so either ultrasound and CT are running along while this is happening. Okay, and coming to this one, in this local anesthesia is used. Okay, local anesthesia is used actually at very rare cases. Only for this one, the needle core biopsy they usually do it. Fine needle aspiration they do not. Okay, because it's just a it's not painful really. It's depending on, see, sometimes if it's for a lump, FNA is not painful. If it's for kidney, can be depending on kitna that person can take, but usually they do not use it. Okay, the other that is the two different kinds of, one straight needle and one this one in precutaneous. In the other one, that is open biopsy. Okay, in that they cut. Okay, so they cut the patient and for 5 inches, 5 centimeter, 5 inches they will cut and then they will do a open kidney. So that means they will take a tissue by opening it, or either one is the laparoscopy. So yeah, that is also done under okay, those both are done under general anesthesia depending. So for all the 4 types of biopsy, they usually use lidocaine. Okay, and they do not directly administer lidocaine. First they will give a starting dose, okay, testing dose, that is usually 3 ml to 2 ml to 3 ml, 0.5 sorry 1.5 lidocaine, but that is 5 minutes before administering, because lidocaine can cause very severe kind of reactions also, so that is why they give a test dose before. Okay, so yeah, so that was the whole renal biopsy. Got it clear? Now this is the protocol that is used in our BBH hospital. Okay, so this is the pre-biopsy. So anticoagulants, NSAID, antiplatelets, okay, these 3 drugs are stopped before renal biopsy. Specifically NSAID and antiplatelets are usually stopped 5 days before. In worst case scenarios that the patient has to get, even anticoagulants is stopped actually. Okay, in worst case scenarios they try to stop it before 3 days. Okay, in certain patients you cannot stop, right? So for them 3 days specific. Okay, and without these lab reports they cannot start, they cannot do renal biopsy. So these are the range in which it should be there. Okay, so below 1 lakh and all they can't do it, so it has to be 1 lakh above. And then main reason to do a renal biopsy, one of the main reasons is like if they have the kidney sizes are big, that means basically they will check the kidney size. If it's big, then they will definitely do it, and they will do the other, like instead of doing the fine needle aspiration, they'll directly go for the open biopsy. Okay, the other two. Yes, so all these all these things are checked, and before this thing, because it can cause severe bleeding. Okay, now coming to this is post biopsy. What all you guys have to check. So for us, as PharmD students, we can actually see this and tell them to stop it. Okay. Okay. Yeah. After for this discharge instructions will be there, right, after the thing. So it's like bed rest for 1 day, limited activities for 3 days. So basically they'll be open, so they have to be safe that it doesn't get spread, cleaning of the wound so that there is no infections, and they have to come after 1 week for checking, okay, for again just to check if the wound is infected or not. So these are the main things. When they are admitted for 1 day, they will be admitted in the hospital. After that 1 day they leave. Okay, now why, I'll tell you. This bed rest for 24 hours that I told, hematuria can occur because the hematuria is blood in the urine. Yeah. Then the pulse rate and the BP is monitored. I'll tell you the monitoring scale also, and abdominal pain. So that this should be the proper, level should be between in this, okay. And now the only tablet that is given after having biopsy is given, this is tablet Ultraset, that is given one, it's a tramadol and a paracetamol combinational drug, okay. So this is given in a frequency of 101, that means 1 in the morning, 1 in the night for 3 days. Then after that these medicines can be re-administered. In certain patients, like I told, can be started earlier, but then definitely the INR, PNR levels has to be maintained. That means the patient has to be in hospital itself. So this PR, like the pulse rate and the BP is monitored for almost 20 hours. Okay, like well, that 1 day admission, no, in that time. So when it comes, then 15 minutes, after 30 minutes, like that it keeps going. And a patient can have purpura, you guys know, right, red spots because of bleeding internal. So those things has to be checked, and before leaving they need to minimum have 4 samples of the urine, okay, only then they send back, and then when they come after 1 week they are retested. So that is a protocol that is used in BBH. Thank you.